Ganis, and I am going to talk about the skeletal system. The 206 bones of the skeletal system carry out 6 important anatomic and physiological functions. They protect internal tissues and organs. They stabilize and support the body. They provide surfaces for a muscle, tendon, and ligament attachment. They move through liver action when contracted. They produce red blood cells in a bone marrow in a process called hematopoiesis. And they store mineral salts, for example, calcium. The skeleton is divided into parts, the axial and appendicular. The axial forms the body's vertical axis and contains 74 bones in the heart and dorsum. It also includes 6 bones in the middle ear for a total 18 bones. The axial skeleton includes the skull, the rib cage, and the vertebral column. The skull includes 28 irregular bones in 2 major areas, the brain case or cranium and the face. 8 bones form the skull, 14 bones make up the face, and the inner ear includes 6 ossicles or 3 small bones in each ear. The mandible is the only movable bone in the skull, and the sutures are immovable joints that hold the skull bone together. The coronal suture unites the frontal bone with the 2 parietal bones. The squamous suture unites the parietal bone with the temporal bone. And the lambdoid suture connects the parietal bones with the occipital bone. The occipital bone forms the rear portion and the base of the skull, and there is also a large opening at the base in the occipital bone called the foramen magnum. And it is all. Thank you.
Hello, I'm Monica Salazar. I made with the clay the facial bones and the sternum. The sphenoid bone is located in the cranial floor. This bone is essential for the frontal, parietal, occipital, and ethmoid bone. The bones of the face include 2 maxillary bones, the mandible, 2 nasal bones, 2 lacrimal bones, 2 zygomatic bones, called malar bones or cheekbones. The vomer is a bone that's part of the nasal septum. The flexible spinal column contains 24 vertebrae and the sacrum and the coccyx contains 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. The sacrum is a single bone that results from the fusion of 5 vertebrae, and the coccyx is result of the fusion of 5 or 4 vertebrae. The sternum is located in the center of the chest. Sternum, ribs, and thoracic vertebrae forms a protective enclosure around the vital organs.
Hello, my name is Juan Salinas. The next part is appendicular system. The appendicular system conforms for different bones. The upper extremity and lower extremity, and the bones and the low of the upper extremity. This the scapula, humerus, radius, and ulna. The conform the hand is a carpal, metacarpal, and fingers conform the distal part. Then the next part is a lower extremity. The lower extremity conform different bones, and one bone is a pelvic bone in this part. Then femur bone, tibia bone, and fibula bone, and patella bone conform a lower extremity.
Hi, I am Ivan Avila. The foot bones form a strong, stable arc with lengthwise and crosswise support. 7 tarsal bones articulate with the tibia and the fibula. The astragalus forms part of the ankle joint. The calcaneus is the largest tarsal bone. The scaphoid or navicular bone is this. The cuneiforms, lateral, intermedial, and medial, and the cuboids articulate with the metatarsal bones. Five metatarsal bones articulate form the foot. And the 14 phalanges are similar to fingers. Bones are classified according to their shape in long bones, short bones, flat bones, and irregular bones. All bones consist of 2 types of bone material: an outer layer of dense, smooth, compact bone, and inner layer and spongy cancellous bone. The compact bone is found. Is this the compact bone? It is found especially in the shaft of the long bones and in the outer layers of the short, flat, and irregular bones. Cancellous bones fills the central regions of the epiphysis, is this, and the inner portions of the flat bones, short and irregular bones. The long bones contain number structures. Diaphysis, this is the diaphysis. Diaphysis, the long narrow shaft of the bones and contains the bone marrow. Epiphysis is this. Epiphysis, the bulbous ends of long bones and that provide a large surface for the muscle attachment and give stability to joints. And articular cartilage is this. A thin layer of hyaline cartilage that covers and cushions the articular surface of the epiphysis. And periosteum, this is periosteum, is a dense membrane that covers the shaft of long bones. And medullary cavity, a cavity filling with bone marrow. And endosteum, a thin membrane that lines the medullary cavity and contains osteoblasts and osteoclasts. Thank you.
Hi, my name is Diana. I am going to tell you about causes of joint pain we know there are different diseases can produce this type of the condition. It is perhaps separate them in two causes. The first time is joint pain from arthritis versus joint pain unrelated arthritis. The first time in inflammation is inflammation condition occurring within joint space. And this type of team include different diseases, for example, osteoarthritis, gout, septic arthritis, polymyalgia rheumatic, systemic lupus erythematosus, rheumatic arthritis, infection arthritis. While the second time include, for example, arthrosis, depression, and fibromyalgia. The first team we can see different things. For example, osteoarthritis. We know this is a disease the most commonly form of arthritis, and this type of disease tends to affect different joints. For example, joint of phalanges, joint wrist, wrist joint, and for example there is a hip joint, and the other, for example, the arthritis, septic arthritis, it tends to affect a single joint. For example, one finger joint, for example, or for example in fibromyalgia, we know here can be with other condition. For example, in this condition affect, for example, the wrist. It can be with other things. For example, swelling, warm, redness. For example, in your in her him knees. When to see a doctor when you present this type of the pain with fever or feeling ill, or when this type sudden and numbness with joint, when you're when that type of disease, you have to see your doctor. Thank you.
We're gonna talk about the cartilage. It is a dense connective tissue which gives bones and joints the support for shock absorption. It consists of fibers embedded in a strong gel-like substance. It has flexibility but has no blood or nerve supply. There are a lot of types of cartilage. We have the fibrous cartilage. This type of cartilage is found in the meniscus and in the intervertebral disc. Then we have the hyaline cartilage. This type of cartilage covers articular bone surfaces and it connects the ribs and the sternum. Then we have the elastic cartilage. And this type of cartilage, we can find it in the epigastrium. Every bone in the body is connected to another bone by flexibility connective tissue, except the hyoid bone, which this bone is basically anchored to the tongue. We're going to talk about the bone movement. Bones are rigid structures that can't bend without being damaged. Individual bones move at joints, sites, or articulation. We can classify the joints by the movement they are able to make, like the synarthrosis joint. This type of joint is immovable. Then we have the ambiarthrosis joint. This type of joint it is slightly movable. And then we have the diarthrosis joint. This type of joint is freely movable. The joints can also be divided depending on the type of structure of their cartilage. So we have the fibrous joint. This type of joint, the two surfaces of the bones are bonded closely by fibrous connective tissue, and this type of joint has little movement, and we can find it in the skull suture. Then we have the cartilaginous joint. This type of joint, it has cartilage which connects one bone to another, and the joint allows slight movement, and we can find it in the symphysis of the pubis. Then we have the synovial joint. This type of joint are covered by articular cartilage and joined by ligaments lined with synovial membrane, and this includes the articular capsule. The articular capsule is a sac-like envelope whose outlayer is lined with a vascular synovial membrane. This membrane contains synovial fluid which lubricates the joint. And this type of joint also has a bursa, which are synovial fluid sacs located at friction points of all types of joints, as well as between tendons, ligaments, and bones. Bursa cushions these structures. There is also a synovial subdivision. This division is based on the structure and type of movement of the joint. We have the gliding joint, which we can find in the wrist and ankles, and they allow adjacent bone surface to move against one another. We have the hinge joints, which are found in the elbows and knees, and they permit movement in only one direction.
Now we'll continue with the herniated disc. The herniated disc is a rupture area on the cartilage that cushions the intervertebral disc. This is a painful condition. The next is a bunions. The bunions are localized areas of swelling that occur on the foot near the joint of the big toe. The next is calluses. The calluses are hard bone formation that may occur at the site of the bone fracture here. Some of the most common diseases of the skeletal system are the arthritis, and we have a healthy joint and a joint with osteoarthritis. The osteoarthritis, also known as degenerative arthritis, affects the joint of the hand, the knee, the hip, and the vertebrae. And this is joined with a rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disease that affects the synovial membrane. Another skeletal system disease is osteoporosis. Osteoporosis is a disorder in which bone mass is reduced and causes bone fragility. Now, the bone tumors can be benign and non-cancerous or malignant cancerous. And we have osteochondroma, osteosarcoma, and chondrosarcoma. The osteochondroma is a common type of tumor that causes projection at the end of the long bones. The osteosarcoma is a fast-growing malignant tumor that affects the tibia, the femur, and the humerus. The chondrosarcoma is a slow-growing malignant tumor that affects the hyaline cartilage. And the treatment of the joints and bones, we have arthrectomy. It's the excision of a joint. Arthroplasty is a surgical reconstruction of a joint. And bone marrow transplant, this is administration of marrow aspirated from a donator's bone to a recipient. Laminectomy, this is a surgical excision of the lamina and Osteotomy, this is a section of the bone or a bone part. And these terms relate to invasive treatment of the joint as the bone.